Hi, this is Dr. Jeffrey Goodlow, Medical Director for the EMS system for Metropolitan Oklahoma City and Tulsa. For over 4 decades, we have spent continuous efforts to find better outcomes of sudden cardiac arrest. And that includes better techniques of cardiopulmonary resuscitation. A lot of that effort has been spent on chest compressions, most often faster chest compressions, deeper and harder chest compressions. The reality is there are better answers, and we are finding them at a rate faster than ever before. So, we have made some very focused efforts in our EMS system in the last several years now to slow the rate of chest compression using a metronome to index it to the best outcomes possible. And by the best outcomes, we specifically are talking about neurologically intact survival. One of the devices we've used for a number of years now, in fact over a decade, is the impedance threshold device known by its trade name as the RESQCpr. When placed in the airway circuit, it helps to increase circulatory return into the chest. The heart is really just a simple pump. It cannot pump out what it does not get in. And so we've used this device for a number of years with that purpose of increasing the venous return to increase the cardiac output and hopefully to the areas where it matters most, the myocardium itself, and to the brain. Now, with FDA approval in 2015, we're using an additional device, the RESQCpr pump. This turns a 1-stroke chest compression cycle into a 2-stroke chest compression decompression cycle. The hope is, with each of that decompression components of the 2-cycle stroke now, is that we are pulling more venous return into the chest. And again, more venous return means more cardiac output, more forward flow, more perfusion. And you can see that by the graphic you're looking at right now, showing an ever-increasing amount of flow into the left ventricle, again, more flow in, more flow out, and to the brain. In fact, when used together, there is a synergistic response to the impedance threshold device and the RESQCpr pump, such that the brain flow is actually even greater than in pre-cardiac arrest. Let's look at the proper mechanics of active compression-decompression CPR now.
This video is intended to help you understand how to conduct hands-on training for the RESQCpr system and what to look for and correct. Feedback from early usage of the device indicated the training on certain aspects of performing RESQCpr is essential to a good experience with the device.
First, we are going to demonstrate how RESQCpr should be done properly. Ensure the chest is dry. It may be necessary to shave excessive hair. Move the patient's arms above the head. Place the RESQCpr pump in the middle of the chest, centered between the nipples, but making sure the suction cup is above the xiphoid process. Do not grip the device too tightly. Note that the rescuer is kneeling on a pad to ensure his shoulders are over the device and the sternum. Push down to the appropriate depth, for example 2 inches, and check the gauge to see how much force that requires. For patients with average chest compliance, this will be approximately 40 kilograms. Be sure your motion is straight up and down so the suction cup is not pushed at an angle, as this can cause slippage. Avoid using your arms. Instead, hinge at the hips and attempt to pull up on the device with 10 kilograms of lift. Use less upward force if the suction cup dislodges. This lifting is a critical motion that rescuers are not used to doing. It is important to ensure rescuers get comfortable with this lifting motion. Point out that if rescuers lift too much, it may cause the suction cup to dislodge. If this happens, they should pull up with less force. Once you are comfortable with the push-pull motion, turn on the metronome. RESQCpr is performed at 80 compressions per minute to allow the heart time to accommodate the increased blood return. The more effective CPR is, the closer it can be to a normal heart rate. The metronome is two-toned, one for lift and one for compression. Think up, down, to the tone. Once compressions have begun, place the RESQCpr ITD-16 into the ventilation circuit as quickly as possible. If using the ITD on a face mask, use a two-handed technique to ensure a tight face mask seal. When using the ITD, turn on the timing lights to guide ventilations. When ROSC is achieved, the RESQCpr ITD should be removed. Keep it close by in case the patient rearrests.
Now we are going to demonstrate RESQCpr being performed poorly to help you identify issues to point out during training.
What is wrong in the first segment? First of all, it is critical for shoulders to be over the sternum and compress and lift straight up and down. Failure to do this can lead to suction cup slippage. Finally, be sure people do not grip the rescue pump with too much force. It will lead to early fatigue. What can you find wrong in this segment? The compression phase of RESQCpr needs to be compressed 2 inches or 5 centimeters, which isn't happening here. The force gauge can be used to help rescuers ensure they are reaching the right depth. Aim for 40 kilograms in the green zone. What is wrong in this segment? Here the rescuer isn't pulling up enough during recoil. The RESQCpr system allows rescuers to perform true active decompression with up to 10 kilograms of lift. It is important that the rescuers get a feel for pulling on the chest, which they are not used to doing. Use the force gauge to guide active re-expansion beyond 0 to as much as 10 kilograms. What is wrong in this segment? Here the rescuer is using too much force during chest wall recoil. It is not necessary to pull up with more than 10 kilograms of force. What is the rescuer doing wrong here? The compression rate is too fast and they are not using the metronome. It is important to teach people to use the metronome because RESQCpr is performed at a rate of 80 per minute, which most people are not used to doing. The metronome is two-toned, so compress on one tone and lift with the next. What is wrong here? The rescue pod only works with a face mask when there is a good seal. We recommend a two-handed seal. Also, the timing light should be used when providing asynchronous ventilations. What is wrong here? The rescuer is using his arms and not hinging at the hips. He will likely fatigue quickly. Keep your arms straight and directly over the sternum for best results and minimal fatigue. Remember to rotate frequently per your medical control protocols. What is wrong here? The rescuer is straddling the patient. This position will lead to serious injury to both the patient and the rescuer. What is wrong in this segment? Avoid any rescue pump use when the patient is in motion. This includes during movement of the patient to the ambulance and during transport of the patient to an emergency department.
Summary: when training, it is important to ensure, with the rescue pump, positioning over the sternum. If the device slips, check position. Arms straight, hinge at the hips. Compress to proper depth and then use the force gauge to guide compression depth. Lift up with 10 kilograms of force using the force gauge. If suction is lost, pull up slightly less. Use the metronome to ensure the proper rate. With the rescue pod, use the timing lights with any airway. Use a two-handed seal on a face mask. Remove both devices when ROSC is achieved, but keep nearby in case the patient rearrests.
Recall that this device is not just in theory, but it has been practically put to the test in the RESQCpr trial that was conducted over a number of years in the 2000s. This was the trial that was used as evidence in the FDA approval process. And you'll see on this graphic that you're looking at right now that there was a 53% relative increase in neurologically intact survival. That's a big part of why we're so enthusiastic about this device. Remember, part of the proper mechanics of using the active compression-decompression device, the RESQCpr pump, is let the device do as much of the work as possible. Yes, it is a manual device, not mechanical, but let the device do the work. Make sure that you are using good mechanics. Let the depth of compression set the force, not the force set the compression. So when you have achieved a 2-inch compression, index the amount of force that achieved that. That's what you want to use repetitively. If you're having trouble with the device in the decompression phase, don't get so focused on the 10 kilograms of force. Just use a proper and effective decompression force. So, what it's all about is patient outcomes and achieving the absolute best neurologically intact survival from sudden cardiac arrest that we possibly can. I want to thank you for your time today in looking at this video and in always being so dedicated to optimal outcomes in pre-hospital emergency care. A special thanks to the Emergency Medical Services Authority and their personnel for assisting in this video training today.